Hi, Julian. I'm Natalie. I'm going to be your nurse today.
Hi, it's nice to meet you.
So today we're going to be doing, before your surgery, I'm teaching you how to use your crutches because you're getting knee surgery tomorrow. And we want to do this teaching pre-op so you can understand it better. And we're going to do a demonstration for you. And we're going to have you demonstrate back to us that you can properly use your crutches so we can send you home. So to start off with, we want to make sure you have proper fitting crutches. So before you even use your crutches, we're going to have you stand up on your sides and hold your hands to your side. And you should have about 2 inches between the crutch and your armpit. And then you're going to put all your weight in your hands and not on your arms because that could cause a loss of sensation with pushing on the nerves. And then you're going to have a slight 30-degree bend in your elbow. Okay, so your crutches fit you properly. I'm going to go ahead and show you. We're doing 2 different kinds. So you're going to start off with a 3-point after your surgery, which is where you're going to keep your knee up off the floor so that you're not putting any weight on it to start off with. And then we'll put you onto a 4-point, which is as you progress and you can put more weight on your foot. So with your 3-point, you want to make sure before you start going at all that you have a nice clear floor, no rugs or toys or anything laying on the floor, proper shoes outside, watch for ice, and on the inside try to keep proper footwear so that you don't slip and trip. So with your 3-point, you're going to put, again, your hands on all the weight on your hand grips, your affected leg up, and you're going to put your crutches 12 inches in front of you, and then you're going to swing your foot through in line, just like so. You don't want to take big steps. You're going to keep small steps, okay? So go ahead and demonstrate for me. All right, thank you. That's good. Now, some things to look out for when you are using your crutches is to make sure you keep some things to look out for is to make sure you look at your skin under your armpits to see if there's any irritation, because if you are putting that pressure on there, then you will be maybe getting some pressure ulcers under your armpits. You also could put some extra padding over top of it to help prevent that. Some other problems that could arise is if you do trip and fall, that could cause more problems and put you back in the hospital. And I think that's it for the safety. When we do this, you can eventually use these to go upstairs, but we want you to make sure you're comfortable first. And you will use the handrails, and you'll put both crutches on one side, and then use the handrails as you go up, and you'll put your non-affected leg up first, and then follow through with your affected leg. Anything else to report to the healthcare provider is if you have a increased shortness of breath or any fever. And so now we're going to go over the 4-point. So with the 4-point, after you have been cleared to put weight on all your feet, you will do your right crutch forward 12 inches, then your left foot, then your left crutch 12 inches, and then your right foot following in line with that. So go ahead and demonstrate for me. Good. And as long as you're make sure you're keeping that pressure all on your hands and all your body weight on your hands. So just, to go over it again, we'll do another 3-point. Pressure all on your hands, and you do 12 inches in front, and then swing through in line. Just small steps. Go ahead and demonstrate again. Good. All right. And then we'll do another 4-point demonstration. Remember, right crutch, left foot, left crutch 12 inches, right foot. All right. Good. So now some other tips for you is we want you to keep your hands free, so when you do need to carry anything. So another reminder for you is to keep your bottom of your crutch tips dry, and always check to make sure that you don't have your crutches bent before you get up to start using them each and every time. I'm also going to show you how to sit down on a chair, a bed, or to go to the restroom on a toilet. So to start with, you'll come up to the chair, and then I want you to you'll put your back of your knee to the back of the chair on the edge, and then you'll move to your affected side, both crutches. And then you'll grab the back of the chair to support you, and then as you go to sit down, let your injured leg just slide out in front of you like this. And then to get back up, it's similar. You would hold on to the back for support, but you scooch to the front of the chair, making sure that this is your left leg that's not affected is still on the edge, and you'll use your free hand after you got a good stable foot to push yourself up until you're standing. Make sure you're steady, and then put your other crutch back under your arm, and then you are free to go. And this can be also used on your bed and your toilet. So go ahead, I'm gonna help you through it. So go ahead. Slowly turn so you don't trip yourself. Make sure your back of your knee is all the way to the back of the chair. Yep. Now go ahead and put your left crutch in your right hand and hold on to both of them, keeping your weight off your foot. And then grab the back of the chair, and then as you sit down, let your foot slide out. Yep, just like that. And then a tip that people don't know is when you actually lean your crutches up somewhere, you should not lean them on the bottom. You should turn them over and actually lean them on the top so they are not to fall. And this will help prevent them from getting damaged and being still safe to use. Alright, so now as we're going to get up, you would get your crutches and put them again both in your right hand of your affected side. And then go ahead and grab the back of the chair and slide forward so you're on the edge. And then when you go ahead and push up, make sure you're pushing most of your weight on the back of the chair and not just on the crutches. And push yourself up, and then make sure you're stable. And then you can go ahead and put your crutch in your other hand. And remember to always have proper positioning before you start moving, and not be putting that weight in your armpit and on your hands only. Good. So you're only using these crutches for a short period of time, and that is why we are using the axillary crutches. If we were going to have you use them for a lot longer time, maybe to permanently be able to ambulate, we would use forearm crutches, and they're very similar. They just, most of your support is also on your forearm. It guides it, but you do have your hand on your weights, your weight on your hands as well. Okay. I think that's it. If you want to use a fanny pack or a backpack, it allows you to keep your hands free and on your crutches. We don't want you carrying anything. Some other things to look out for is if you have any sudden chest pains, or if there's any redness and more skin irritation. Other things that could happen is your nerve endings your nerve endings we need to look out for, and skin irritation is one of the biggest things. And just if you have any questions, don't hesitate to call and ask. We want you to make sure you stay safe. Alrighty, so that concludes our demonstration for today. Do you have any other questions for me?
I was wondering if you guys had any content, just in case I forget by the time surgery rolls around.
Yes, so we do provide you with a take-home pamphlet that I do have here that explains what we went over today about 3 and 4 point crutches and why you are using them for your surgery. And we do have another explanation for you to read again if you forget how to properly use them. and what to look for and what to call the healthcare provider for. So if you have any questions, just go ahead, review this, and if you still have more questions and it doesn't clarify enough, go ahead and call us, okay?
Okay, thank you.
You're welcome.